A cesarean section, also known as a C-section, is a surgical procedure performed to deliver a baby. It involves making incisions through a woman's abdomen and uterus to safely deliver the infant. While vaginal delivery is the most common method of childbirth, C-sections are becoming increasingly common for various medical reasons. Cesarean sections are considered major surgery and require careful planning, execution, and post-operative care. They are typically performed by obstetricians, medical doctors specializing in pregnancy, childbirth, and the postpartum period. The procedure is carried out in an operating room with a team of healthcare professionals. C-sections have become an essential part of modern obstetrics, providing a safe alternative when vaginal delivery is not possible or advisable. Understanding the reasons, procedures, and recovery associated with C-sections is crucial for expectant parents who may be considering or facing this surgical intervention. This comprehensive guide will delve into the intricacies of C-sections, providing valuable insights for expectant parents and anyone interested in learning more about this common surgical procedure. Cesarean deliveries are performed for various reasons, both planned and unplanned. A C-section may be scheduled due to pre-existing maternal or fetal conditions, or it may be decided during labor if complications arise. Common reasons include breech presentation, multiple pregnancies, placenta previa, maternal health conditions, and previous C-sections. Emergency C-sections may be needed for fetal distress, prolonged labor, or other complications. The decision involves the medical team and the family. The goal is the safety of both mother and baby. Preparing for a C-section involves several important steps to ensure the safety of both the mother and the baby. Prior to the procedure, the mother will undergo various assessments and preparations. These may include blood tests, an electrocardiogram, and a review of medical history. The mother will also receive specific instructions regarding fasting before surgery. This typically involves abstaining from food and drink for a certain period. This is crucial to prevent complications during anesthesia. The medical team will provide clear guidelines on what to expect before, during, and after the C-section. In the operating room, an intravenous line will be inserted into the mother's arm to administer fluids and medications. The surgical site, typically the lower abdomen, will be cleansed and prepped with an antiseptic solution to minimize the risk of infection. A catheter may also be inserted into the bladder to drain urine during and after the procedure. Throughout the preparation process, the medical team will be available to answer any questions or concerns the mother may have. It's important to remember that a C-section is a team effort, and the medical professionals involved are dedicated to providing the best possible care for both the mother and the baby. Open communication and a supportive environment are crucial during this time. Section 4. Anesthesia. Ensuring a pain-free procedure. Anesthesia plays a crucial role in C-sections, ensuring the mother's comfort and pain management throughout the procedure. There are two main types of anesthesia used for C-sections: spinal anesthesia and general anesthesia. Spinal anesthesia is the most common type used for planned C-sections. Spinal anesthesia involves injecting an anesthetic medication into the fluid surrounding the spinal cord in the lower back. This numbs the lower half of the body, while the mother remains awake and alert. General anesthesia, on the other hand, renders the mother completely unconscious during the procedure. It is typically reserved for emergency situations or when spinal anesthesia is not suitable. The choice of anesthesia depends on various factors, including the mother's medical history, the urgency of the situation, and the preferences of the mother and the medical team. Before administering anesthesia, the anesthesiologist will thoroughly review the mother's medical history, allergies, and current medications to minimize any potential risks. The anesthesiologist will continuously monitor the mother's vital signs, including heart rate, blood pressure, and oxygen levels, throughout the procedure. They will also be responsible for managing any pain or discomfort the mother may experience. The goal of anesthesia is to provide a safe and comfortable experience for the mother while ensuring the well-being of both the mother and the baby. Section 5. The Cesarean Section Procedure, a step-by-step guide. The cesarean section procedure is a carefully orchestrated surgical procedure that involves delivering the baby through incisions made in the mother's abdomen and uterus. Once the anesthesia has taken effect, the surgical team will proceed with the C-section. The procedure typically takes about 30 to 45 minutes. The first step involves making an incision in the skin and underlying tissues of the abdomen. This incision is usually made horizontally just above the pubic bone, known as a bikini cut. Next, the surgeon carefully makes an incision in the uterus, exposing the amniotic sac that holds the baby. The surgeon then ruptures the amniotic sac, drains the amniotic fluid, and gently guides the baby out of the uterus. The umbilical cord is clamped and cut, and the baby is handed over to the waiting medical team for immediate care and assessment. After the baby is delivered, the surgeon removes the placenta and sutures the incisions in the uterus and abdomen. The skin incision is typically closed with staples or sutures. The mother is closely monitored throughout the procedure for any signs of complications. Section 6. Immediate post-operative care. Immediately following the C-section, the mother will be transferred to a recovery area where she will be closely monitored by healthcare professionals. The medical team will monitor the mother's vital signs, including heart rate, blood pressure, and breathing, to ensure a smooth recovery. Pain management is a top priority during this time. Pain medications are administered as needed to alleviate discomfort from the surgery. The mother will also receive assistance with breastfeeding or bottle feeding her newborn if desired. Skin-to-skin contact between mother and baby is encouraged as soon as possible, as it offers numerous benefits for both. It helps regulate the baby's temperature, heart rate, and blood sugar levels, while promoting bonding and a sense of calmness. The medical team will provide guidance on post-operative care, including wound care, pain management, and signs of potential complications. It is crucial for the mother to follow these instructions carefully to ensure a smooth and healthy recovery. Section 7. Recovery and healing after cesarean section. Recovery from a C-section takes time and patience. The mother will need to rest and recuperate while her body heals. Pain management is crucial in the days and weeks following surgery. Pain medications prescribed by the doctor help manage discomfort and allow for mobility. It is important to gradually increase activity levels as tolerated. Walking short distances around the house can aid in recovery and prevent complications. However, strenuous activities and heavy lifting should be avoided for several weeks. Incision care is essential to prevent infection. Keeping the incision clean and dry is crucial. The doctor will provide specific instructions on how to care for the incision, including when to change dressings. It is also important for the mother to listen to her body and rest when needed. Fatigue is common after surgery, so getting enough sleep is crucial for healing. A balanced diet and adequate hydration are also essential for recovery. Fruits, vegetables, and protein-rich foods provide the nutrients needed for healing. Drinking plenty of water is also important for overall health and recovery. Don't forget to like and share this video, subscribe to our channel, and hit the notification bell to stay updated with our latest content.